Begin by demonstrating the Allen test. We palpate the radial artery on both wrists using our thumbs, elevate the hand and compress both radial arteries. We then ask the patient to make a tight clenched fist to squeeze the blood out of the hand and hold this position for 1 minute. Subsequently, the hand is lowered and the patient is asked to open the fingers. We look for return of color to the hand. Although no time was mentioned by Allen, most physicians agree that a return of color should occur within 6 seconds, and a delay greater than this indicates a positive Allen test. The test can be repeated then by compressing the ulnar artery. Thank you.
Yes.
We will now demonstrate the modified Allen test. In the modified Allen test, both the radial and ulnar arteries are palpated and compressed using the index, middle, and ring fingers of both hands. This compresses a longer segment of the vessel and ensures total occlusion of the vessel. The patient is then asked to make a tight clenched fist and elevate the hand to squeeze the blood out of the hand. One can also ask the patient to open and close the fingers 10 times to make sure all the blood is squeezed out. Stop. Open. The patient is then asked to open the fingers and compression of one of the vessels is released while looking for return of color within 6 seconds. The test is again repeated by releasing compression of the other vessel. For both the Allen and the modified Allen test, it is important to make sure that the patients are not keeping the wrist and fingers hyperextended or splaying the digits out. Keeping it in this position can give the appearance of a pale hand even without compressing the vessels and can lead to a false positive test. Thank you. The digital Allen test is done by squeezing the blood out of the digit being tested using the thumbs of both hands from distal to proximal and then compressing the digital arteries at the base of the finger, just distal to the palmodigital crease. The index finger at the back of the digit being tested provides a counter. The digit should appear pale. If not, one can ask the patient to flex the digit a couple of times while maintaining compression to empty the blood from the digit. Now, compression of one artery is released while observing for return of color to the digit. The test can be repeated by releasing compression on the other digital artery. Thank you.